Hi everyone, my name is Veena Sriram, and I'm delighted to be here with you to talk about my leadership project for WomenLift Health, which is to develop a network of global health researchers here in British Columbia, Canada. I want to begin by acknowledging that the lands on which I live and work are the traditional, ancestral, and unceded territories of the Musqueam people. This picture here on the right is Pacific Spirit Forest, which is just a couple of minutes from where we are on campus, and feel very fortunate and very grateful to be able to live here and be part of this really extraordinary community. To tell you a little bit about myself, I'm an assistant professor here at UBC, and I work between our schools of public policy and our schools of public health. And my research interests are in studying the politics of health policy processes. Most of my research has been focused on low and middle income countries, but over the last few years have also been studying these topics in Canada. Home for me is Chennai, India, and I've also been grateful to spend some lovely years in Chicago and now in Vancouver. So, the motivation for this project stems from persistent inequities and gaps that we see in the academic and knowledge generation sector when it comes to global health research, predominantly experienced by researchers from the global south, also by women, and by other communities that experience marginalization. And of course, important to take an intersectional lens in terms of thinking about how these identities intersect with one another. In terms of the impacts of these inequities, we see them in many different aspects of our field. One of the most prevalent is in terms of research output, and we also see it in the availability of networks and platforms, or the lack thereof, and finally in career growth opportunities. Personally, I know how formative networks have been for me during my graduate training, and I was very grateful that I had, a few interested faculty members who informally gathered groups of graduate students working on interdisciplinary research related to global health from multiple universities that were close to each other, and just got us together to talk, share, learn from each other. And I found those networks to be really inspiring to me, and have always wanted to try and recreate that in a university setting if given the opportunity and if the need existed. So my goal for this project is to build an interdisciplinary and international community of graduate students and early career researchers here at UBC who are engaged in global health research and practice. And the specific objectives are to create a regular convening for these individuals, but to also develop a group of local and virtual mentors who can provide regular support and guidance to these individuals. So, the reason for this project is that here at UBC, we're really fortunate to have phenomenal graduate students and postdoctoral fellows from around the world working across departments and schools on topics related to global health. But the challenge has been that there have been few to no spaces to convene these students around their interests. And many students and postdocs have expressed this to me as a key gap and something they're really looking for to help strengthen or improve their experience here in terms of being part of a community. And one of the other reasons this is important, I think, for us to do is because we have the resources here in terms of really interested and committed faculty working on these issues who want to mentor and support students, and also within the province at large. How we're going to do this is a multiple step process, which I'll give you a quick snapshot of. The idea is to build an advisory group and identify a couple of key partners who would be interested in moving this forward with me. And we will, once we have some funding secured, we will start to put out I'd say, a semi-formal call for graduate students and postdocs here at UBC, and then proceed an academic year's worth of programming, which would include monthly meetings, convenings with their mentors, and other types of supports, not too dissimilar actually to what we have here in Women Lift Health. In terms of the progress so far, I've been able to identify a couple of faculty who are keen to do this as well as support from the Public Health Equity Network here in BC, which comprises of universities from across the province. We have a funding opportunity that's been identified, and we're going to submit that application in the end of the year. And we have and I'm building a concept note that I'm going to get some feedback on this summer. So more to come later this year. I just want to end with a word of gratitude for my amazing cohort members. They have been absolutely inspirational and have really helped me gain a sense of confidence and gain a sense and sort of have really helped, I think, to help me put aside some of the doubts that I had about doing this work. So, a huge thank you to my cohort members and look forward to your questions, the discussion. Thank you.